all your favorite podcast platforms. You could find us on YouTube, and please remember to subscribe. And you can find us at realmeneatplants.com. I have a very special guest today because my friend Dean Mosher I last saw 28 years ago.
Wow.
And we are renewing our friendship today as I interviewed Dean about his specialty. He is an acupuncturist. He is the author of The Complete Guide to Chinese Medicine Bloodletting. You heard me right, bloodletting. And he has been a licensed acupuncturist in the Chicago area for 24 years. So he was not an acupuncturist when I knew him 28 years ago. Dean, welcome to the
Yes.
show.
Thank you. Thank you.
It's
Happy to
amazing.
be
It's been
here.
28 years, and both of us, I think, only look about 14 years older. So
Well, you look exactly the same. So I
you've
was
grown a
shocked
beard.
when you said 28 years.
Yeah. Um, Dean, I guess the first question is, why did you go into acupuncture? Why, I don't remember you even talking about acupuncture at the time when I knew you. And then the second question is going to be, why bloodletting? But let's start with the acupuncture. Why did you go into acupuncture?
So about the time I last saw you, 1995, 1996. So my wife had a terrible problem. She had eczema from head to toe, and nobody could help her. She went to doctor after doctor, and it was just awful. She was itching. She had enlarged lymph nodes from her immune system reaction. And finally, the only relief that she was able to find was with acupuncture. So that opened my eyes. Acupuncture hadn't really been on my radar screen up until that time. But I went to acupuncture school. Um, I was between jobs. I didn't really think that I would become an acupuncturist, but I was very curious about it. So I went to school and just sort of to learn more about it. And one thing led to another. And, I was in school, I was treating patients, and I kept seeing miracle after miracle, and I just got drawn in.
Now, to what extent did the acupuncture help your wife overcome her problem?
Oh, like 80, 90%.
Okay. So to this day, she's 80 to 90% better on that score.
Yeah, yeah, she has remained better.
Okay. Um, and now sometimes doctors don't treat their family. Did you ever do acupuncture on your wife?
I do. I do acupuncture on her. I can understand if you're doing surgery, you don't want to do it on somebody that you're emotionally close to because it's a critical thing, but acupuncture, it's no problem.
Right. So tell us the principles of acupuncture, why you believe it works, and I know acupuncturists often vary very, very widely in their techniques. So tell us something about your technique.
Yeah, acupuncture and Chinese medicine in general, it's such a huge subject. I mean, you could never get your arms around all of it, in a lifetime or several lifetimes. But I'll talk about a few aspects of it. It's not one thing, and the whole idea that there are points and there are long meridians. I mean, that's a very small part of it, actually. Um, so, probably the first um, type of acupuncture that I got involved in, you could call it distal acupuncture, because if the pain is one place, or the symptom is one place, you put needles someplace else. And the basis of that is, I don't know, some of your listeners, I'm sure, are familiar with foot reflexology. And in foot reflexology, the idea is that the foot is a microcosm of the whole body. And if you have, let's say, a stomach problem, you massage the part of the foot that corresponds to the stomach. And acupuncture, the type of acupuncture I'm talking about, um, is along those lines. So if you start looking, you'll see that there are these many redundancies in the body. And so, for example, probably the simplest one is the arms and the legs. So if you look at your arms and your legs, you see they're very similar. You have 10 fingers and you have 10 toes. If you do an x-ray of the wrist, you have all those little bones. It looks very much like the ankle. Um, the anatomy of the foot is very much like the anatomy of the hand. You have metacarpals in the hand and metatarsals in the foot. And then the lower leg is very much like the forearm. The elbow is very much is a joint that you can go until it's straight and no further, just like the knee. Um, the arm is connected to the torso with a ball and socket joint, the shoulder, the leg with a ball and socket joint, the hip, and they're very similar. So if, for example, and you can use that clinically, and it's very effective. So, for example, if somebody has a pain in their wrist, I can palpate around their ankle, and if I find a tender point, and it will be remarkable. They won't even know the tender point is there, but when I press it, they'll jump. And if I needle it, the wrist will be immediately better.
Huh.
If they have a problem in a certain, let's say in their thumb, in this joint in their thumb, then if I put a needle in the corresponding joint in the big toe, that thumb joint will immediately feel better.
Now,
And
let me
as
interrupt you there. Do we have a
sure,
theory? I mean, that makes sense, in an abstract way, but do we have a theory why a needle in the big toe helps my thumb?
well, supposedly embryologically, it makes sense that embryologically these tissues formed at the same time and in the same way, and in some way that makes sense. To be honest, I haven't spent much time um, thinking about the why. Um, just clinically, since I'm an acupuncturist and I have patients coming in, I'm mostly just spending my time clinically trying to see what correlations work and for what types of problems. Doesn't work for every problem, but most problems it does.
Okay.
And if you start looking around, you'll find these correlations everywhere. And so maybe now would be a good time to do to share my screen and show you some of those slides.
Okay, go ahead and do that. Let's see the slideshow.
All right, so let's see. So here, this is a presentation that I did for acupuncturists actually, showing how you can needle the ears for the pelvis. And so if you look at the spine, I, if at the top of the spine, you have a bony structure, and then you have two ears hanging off of them. And then if you go to the bottom of the spine, there's another structure, bony structure, the sacrum. And look, you see that there are two big ears hanging off of it. And it's significant in acupuncture because the skull and the sacrum share a um, a direct yin yang correlation. Um, so I'll just talk about yin and yang for a moment. So yin and yang is the basis of Chinese medicine and of all Chinese philosophy, and it's based on the idea that everything in the universe is based on um, polar opposites. So that nothing can exist without its polar opposite. There is no high without low. There's no good without bad. There's no cold without hot. Um, there's no inside without outside. And this goes on forever. So the closest thing to anything is its polar opposite because they're two sides of the same coin. Um, and that whole concept is summed up in yin and yang. So the top of a structure is the yang, and the bottom is the yin. And so these are related. I had a great uh, uh, professor, teacher of Chinese medicine named Dr. Tan, and he talked about how the groin is very much like your face. Um, you have two eyes. In the groin, you have two ovaries or two testicles. You have a protruding nose. Um, you have a rectum, which is there's a direct yin yang relationship with the mouth, right? There's a tube, and the two ends of the tube are the mouth and the rectum. Um, so all this, it all fits together in Chinese medicine. I know I'm throwing a lot out at one time. Um, but anyway, if you look at these ear-like structures, which are, which is the pelvis, if you look at this area in the circle, you'll see it looks a lot like the Lone Ranger's mask. Here's the Lone Ranger's mask. And so, for example, if somebody comes, so this area right in here is the pubis symphysis. And in pregnant women very often have pain in the pubis symphysis. So I find that if I palpate between their eyes, like right here, I will often find a very tender spot and I can needle that and this pain will be better. Um, there's also in Chinese ear acupuncture. So if you look at this is the ear, um, and this is the ear lobe, this is the eye of the mask. And in fact, the middle of the earlobe is the Chinese acupuncture spot for eyes. Um, so let me move on. Any questions about this so far?
No, I'm following along.
All right. So here's some more. Um, Another look at the you know at the pelvis and how this looks like the ear. So let me go back. So the next slide is a different view. Um, so imagine that you move the ilium out to the right here, and let's say there's a camera right here looking at the inside of this ilium. Oops, sorry. That's my phone. Let me turn that off. And look at how much the ilium looks like the ear. You have the curvature here, the curvature here, the opening here, the opening here. So anyway, you can treat pain in the hip by recognizing these correlations and treating those the corresponding anatomy in the ear.
So you might place needles in the ear and relieve people's pain in the hip.
Exactly. So um, here's a picture that shows how similar the ear and the kidney are. I mean, you find these redundancies everywhere. I haven't actually used the ear to treat kidney disease, but it's something that could be explored. Let me go back here. All right. So here's another one. If you look at this picture. This picture actually is from a it's from a poster for a TV show called Penny Dreadful. And when I saw this, I was really struck because if you look, it's two things, right? First of all, the first thing you might see is a skull. So here's the skull, here's the eye, the left eye, here's the right eye. Here's his skull, bald skull, the top of his skull. This would be the nape of it. This would be the ridge of his nose. But if you look, you also see that this is a person um, bent over. Here's his arm and his hand, arm and hand. Here's his hair. This is the back of his neck. And I use this image to treat a lot of neck pain, shoulder pain, and back pain. How do I do that? Well, if somebody comes in and they have a pain in the back of their neck, so look at the neck on the person, then if I palpate the bridge of their nose, I can usually find some very tender points. And then if I needle those tender points, the pain in their neck will get better. When people have um, when they come in with acute low back strain, I will typically find tender points in the back of their scalp, which corresponds to the low back in this picture. Um, so this is a very good acupuncture image. And when I saw it, I wasn't sure if this was a valid image or not, but I've since validated it clinically, many, many, many times. All right, so let's see if there's anything else. So there's something called ear acupuncture, auriculotherapy. If you go to Europe, most acupuncturists are doctors, physicians, MDs,
Most
and
acupuncturists in Europe are also MDs?
yeah, more so. Here in the U.S., and every state has a licensing law by now, and
Hmm.
acupuncturists are licensed. In many European countries, they don't have a licensing law for acupuncturists, and so there are acupuncturists, but they're kind of operating in a gray area. There are, I would say, a much higher percentage of physicians in Europe who do acupuncture. And most of the acupuncture they do is called auriculotherapy, and it's just the ear. And the reason for that, I think, is because of a French physician by the name of Paul Nogier, who died, I don't know, a few years ago. And in the 50s, he, by accident, discovered ear acupuncture. And he found the first thing he treated was um,
What
sciatica.
he discovered it by accident? Was he
Well,
sewing and a needle went into his ear?
no, the story is that he was working in an area that had a lot of Vietnamese immigrants,
Uh-huh.
and he noticed that many of the immigrants had a scar in a certain part of their ear, and he asked them about it. And it turned out there was a Vietnamese woman who was an acupuncturist who was not only needling them there, but actually cauterizing that area. And it was the sciatica area. So she was treating them for sciatica. So Nogier became very interested in that. And so he started experimenting and he found that if he just needle, he didn't really need to cauterize it and scar it, that if he needled it, if he stuck a hypodermic needle in there, it would have the same or similar effect. And so he started working on it. He was a young physician at the time and he was drawn in. And so he spent the rest of his life elucidating and mapping the ear. And he developed ear acupuncture. And eventually he realized that the basis of this is that the ear is actually in the image of an upside down fetus. So you can, so the head is here This is the spine, which goes to the legs. And here's the eye. Remember I said earlier that this eye was, that this corresponded to the eye of the Lone Ranger's mask. So here it
Right.
is, the eye. It's right there in the middle of the earlobe, as predicted. Um, and I think as a result of Nogier's influence and the fact that he was an MD, so it became very credible amongst MDs in Europe, and that's continued to today. You still see, not all MDs certainly, but in the US, you almost see no MDs doing acupuncture. You
I
see
had an
more.
MD in LA who did acupuncture.
Okay.
That was rare.
Um, uh, California, maybe more, especially because of the high Asian population. California was the first state in the United States that licensed acupuncturists, so that would make sense. Okay, so that's all I have to show you about
All right.
that. So we can
So
talk
we'll end
about
the
that.
screen share.
So yeah, so go ahead and end the screen share, and then later we can
All right.
talk about. I do have one more slide where I show a video on bloodletting, but we can get to that later.
Well,
All right, if you've ever wanted to show off your plant based lifestyle and do it in style, here's your chance. We have some of the most amazing t shirts, hats, accessories, coffee mugs, and more at shop.realmeneatplants.com. We have statement t shirts that will bring a smile to everyone's face. I love the I Want Tofu Tonight tee. Plus, we have podcast tees, Real Women Eat Plants gear, Real Kids Eat Plants, and Real People Eat Plants, just in case men, women, and kids didn't cover it all. Yeah, we love you and love that you want to show off that healthy lifestyle of yours. Again, check out our high-quality gear at shop.realmeneatplants.com and enjoy.
well, that's the next question. Well, let's go back though for the acupuncture. You become an acupuncturist, and was your practice just about the needles? Because I went to an acupuncturist in LA for some leg pain that I had. And I said, I want to try this, see if it could, it was probably sciatica, see if it could relieve the pain. And he said, okay, but I don't use the needles. And I said, isn't that what an acupuncturist does? Use needles? He said, yeah, I don't believe in it. Well, what do you do? And he took my hand, my fingers, and he would press them and he would write down something. And then he was giving me a Chinese tea. That was the
Okay.
whole thing. He gave me a Chinese tea for a couple $100, and it corresponded to pressing my fingers. And I don't think that worked for me. So there are different acupuncturists with different techniques, but most use the needles, right?
So well, there's acupuncture and there are herbs, and those are, they're both Chinese medicine. I wouldn't call herbs acupuncture. Herbs are Chinese medicine. Now,
Right.
herbalism is, it really operates according to different principles. Um, Herbalism operates according to the 8 principles. Um, the acupuncturist will, or herbalist will look at your tongue and take your pulse and determine if your condition is, there are 4 things. So is it internal or external, excess or deficient, um, yin or yang, hot or cold. And based on that, he'll give you herbs. So if you have an internal hot condition, he'll give you herbs to expel heat. Um, I think, typically that's for chronic things like, internal problems like digestive problems. If you have a musculoskeletal problem like sciatica, I think you're probably better off going to somebody who does acupuncture.
Yeah.
And that's with needles, but there are also accessory techniques to acupuncture. So everybody knows cupping by now. Everybody's seen in
Right.
the Olympics, the swimmers with their big round purple marks, and that's from cupping. There's also gua sha, which is where you take a Chinese soup spoon or some instrument and you sort of scrape along the back. And it can turn very red, and that's the red is heat, and heat is inflammation, and that's the inflammation coming out.
All right. So when you started acupuncture, it was just the needles, right?
At first, I was just doing needles, and I was
Okay.
just doing distal needles, like needles that were away from, according to the principles I just told you.
Right.
Now, along the way, I picked up other techniques. I started doing gua sha. I started the scraping I just told you about. I started doing cupping. And I also started doing local acupuncture, which is sometimes called dry needling, which now a lot of physical therapists do it. And it's also acupuncture. Um, the calling it dry needling is, I mean, it's partially a legal thing. I mean, there were states where um, physical therapists were not licensed to do acupuncture. So then they started calling it, but they wanted to do it, so they called it dry needling, and this was something that's been hashed out over the last several years. I think now in most states there are laws that permit physical therapists to do needling, but when they do needling, and when I do needling sometimes, depending on the problem, you put a needle right where the pain is, and the idea is you're looking for trigger points, which are, this is more of a Western anatomical approach where you're looking for these trigger points, which are sort of micro knots, and you put a needle in them and maybe do some stimulation, like a TENS, with some gentle electrical current, and you can release um, that knot.
All right. Now, at what point do you say, hey, it would be a good idea to make my patients bleed, to get into bloodletting?
So I'll tell you how I got into bloodletting. Um, this was, I guess, about 10 years ago, maybe 12 years ago. So there's an acupuncturist named Master Dong, Ung, but pronounced Dong. And Master Dong was rabidly anti-communist, and he left China to go to Taiwan. And shortly after Mao took over, he fled to Taiwan. And he had an incredibly busy practice. He saw hundreds of patients a day. And he was very famous. And he was, the greatest. Everybody recognizes that he was the greatest acupuncturist of modern times. And he
Is
had his
there an
own.
acupuncturist hall of fame?
Uh, I don't know of one, but he
Okay.
would be in it definitely.
Okay.
Um, and he actually his system is, it's a little, the origins are a little murky. Um, but I mean, if you go back a few thousand years, certainly even a few hundred years, I mean, today you have TCM, traditional Chinese medicine. And what everybody believes is that this is acupuncture, and this is the way acupuncture is taught, and this is the way everybody does acupuncture.
Mhm.
But the truth is, that's actually a creation of Mao. And what is called traditional Chinese medicine is actually sort of a made up thing that was created by committees to standardize acupuncture after World War II. Prior to
So
World
it's
War
not a
II,
thousands of years old thing?
oh, it is thousands of years old, but thousands of years ago, hundreds of years ago, it wasn't one, set of points that everybody agreed on. You would have, um, it was practiced differently in different
So,
parts of
so,
China.
so Mao codified tradition.
Correct. That's very well put. Mao codified tradition. And he kind of conflated herbs and acupuncture. Um, which is a
And that
different story.
confused my acupuncturist in Los Angeles.
Well, your acupuncturist, it sounds like, was really an herbalist. I mean, people find it's so big, acupuncture, that
Right.
based on as you're going through school and you have your first few patients and you take some seminars after graduating and you find what you gravitate to and what works for you, um, you start to specialize. And your guy, it sounds like, started specializing in herbs. And when you have a nail, um, or if you have a hammer, then every problem starts to look like a nail. His hammer was herbs. He
Right.
apparently didn't like the hands-on. He liked taking pulses and looking at tongues and figuring out the 8 principles, and probably sciatica is not the best indication to respond to herbs, but that was the hammer he had.
And he had a bad attitude. I said, "Come on, give me the needles." And he said, "Okay, I'll give you the needles, but it's not going to work." So,
Yeah. Okay. Well, there you
thanks
go.
a
So,
lot.
it's funny. He may have had a few patients early in his career and he needled them, and it didn't work. And it's a terrible experience for a new acupuncturist. You have
Yeah,
somebody come to you and they're in pain and they pay you money and you can't do anything. You might just say, well, enough of that. And then he gives
right,
herbs to a few people and it works. He's done with needles. He's an herbalist now.
right. So let's get back to why you decided to start bloodletting.
Yeah. So Master Dong. So I'd say, about the time that I became an acupuncturist, about 2001, Master Dong became all the rage. And so and he getting back to what I was saying, so he did not use the I think it's 361 points, or the points that we all learn and that are supposed to be the standard acupuncture points. He had a completely different system that he learned from his family. And, these things were handed down from father to, I guess, to son usually. And they kept secrets, and acupuncture was practiced differently by different families and differently in different areas. And nobody before Mao could say, this is acupuncture and this isn't acupuncture. This is the right way. This is the wrong way. It was not that standardized. So anyway, Master Dong had his own system, his own points, and people started learning it and getting really good results. But nobody could reproduce the results of the great Master Dong himself. And I kind of got interested in Master Dong, and I was reading a book he had an apprentice who just died a few weeks ago, and he was living in California. And he wrote a lot of books on Master Dong. He really was responsible for keeping his legacy alive. And in the introduction to one of his books, he was just talking about um, how you can recognize a competent acupuncturist. And I said, "Oh, I'm a competent acupuncturist. Let's see." But one of the things that a competent acupuncturist had to be proficient in was bloodletting. And I thought, bloodletting? Seriously, bloodletting? I didn't know anything about bloodletting. I didn't learn it in school. But the way he talked about it, I thought, I'll bet that's the missing link, bloodletting. So I started to look into it, and I just started experimenting. I started bleeding every patient. And the very first patient I bled, like your acupuncture is probably the first people he did acupuncture on, it didn't work. So the universe was sort of telling him acupuncture isn't for you, buddy. The first patient I bled was this guy who came in with like the worst sciatica. He could barely walk. I had him lie face down, and he had these spider veins on the back of his knee, which is the area that you're supposed to bleed for sciatica. And I was scared to death. And I thought, well, it's now or never. I just pricked this guy a little bit, and boy, this black blood came out. And I mean, my heart was pounding. I was terrified. the guy was in no danger, but I'm not sure I knew that at the time. I'd never done this. This guy is bleeding. And I'm thinking, God, I hope he doesn't bleed to death. And
How much blood came out?
it seemed like a lot, but it was probably, I mean, if it was a tablespoon, it was probably a lot.
Oh,
Um, but as the blood's coming out, and I'm terrified, and I'm saying this silent prayer that the guy doesn't like pass out on my table, he says to me, "Oh, I don't know what you're doing, but whatever it is, don't stop. That tightness is really coming off my back." And that was it. I was hooked.
yeah.
I had never had a result like that with a guy, you know, this far gone with sciatica. And when I was done, he was all smiles. He walked out with a big smile. And I thought, this is it. So from that day forward, I was hooked, and I just experimented and experimented and experimented. And, you know, there weren't many people. I didn't have much competition. There weren't many other people doing it. And
Right. And
eventually,
eventually you wrote the complete guide to Chinese medicine bloodletting, which is available on Amazon. And I have read the Kindle version of this. It's fascinating. Um, how many bloodletters are there in America? Do you have any idea?
well, there are a lot more now than there were. America,
Have you helped popularize
I
this
have to
technique?
say, I have, which is very gratifying. I've sold a lot. I've sold a lot of books. I have a Facebook group called Chinese Medicine Bloodletting, which is limited to people. It's not for the general public. It's for acupuncturists or MDs if they want to join. There are a few. Anybody who has a license that permits them to legally poke people with needles and let blood can join. And there are 9,000 members. Um, and, I do seminars and webinars. And so there are definitely a lot more people doing it now than there were, 10 years ago.
Now, when I got hired to write my first episode of television, it was for St. Elsewhere, and went in to meet with the producers, and they said they wanted me to write an episode about the use of leeches in surgery. An episode where some guy's getting surgery and leeches are going on the patient. And I said, all right, I'll do that. And I went home, and the next day, the New York Times had a front page article about the use of leeches in surgery. So I thought, somebody's helping me here. Um,
Wow.
and that is a real thing. I think it's still going on today. What is the theory behind the use of leeches in surgery? Because I don't remember anymore. And what is the theory behind why it's good to let your blood flow a little bit, not all of it? You don't want all of it going.
Yeah. So the reason in Chinese medicine, they talk a lot about blood stasis. Um, the main things that acupuncture. So what does acupuncture do? I guess, we should go backward and back and talk about that. Two things really, relieve blood stasis and relieve qi stagnation. So in other words, flow is good. Qi is energy or function, and or also perhaps um, nerve conduction. And when qi is flowing, that's good. And the same with blood. And if they're not flowing, you have pain. So it's different. It's different from herbalism. It's different from the eight principles. Um, so bloodletting is the best way to relieve blood stasis. Um, I really, at this point, I wonder how an acupuncturist can practice if he or she doesn't use bloodletting, because there are so many things that they could treat easily and effectively with bloodletting that without bloodletting, they're just not going to be able to treat them. certainly not as well, and maybe not at all.
And do leeches serve the same purpose?
So leeches serve the same purpose. Leeches also, so leeches in their saliva have a miraculous blood thinning agent that cannot be synthesized by man. It's better than anything, that we have, any drug that we have. And so, oh boy, I have a picture. Too bad I didn't put it in the slide presentation, but I have a picture in a book I have some books on leaching. And um, typically plastic surgeons use leeches to restore blood flow um, to tissue that is not getting perfused and is getting gangrenous. And I have a picture of a kid who was bitten on the cheek by a horse. He has a horseshoe shaped scar.
It's
And you
interesting that
can,
a horse would create a horseshoe-shaped scar.
isn't it? Yeah.
Talented horse.
There you go. It's
Yeah.
there's those redundancies again,
Yeah.
but in a horse, not a human. So and you can see very clearly that outside of that flap, the skin is pink, and inside it's pale, and the blood is not getting there, and it's becoming gangrenous. And apparently, the plastic surgeon let the leeches loose on that area, and blood flow was restored. And I show a picture of him a year later. You don't even see really. You can barely see that there's a scar there.
Yeah. And
And
that's because the leech is on top of it. So,
yeah, and I wouldn't be able to do that just by bleeding that, probably. It probably has to do with both the bleeding, the relieving the blood stasis, but also that leech saliva.
right. Now, you've never used leeches, have you?
I have never used
Right.
leeches.
All right. So, in your book, I learned that the apex of the ear is a top bloodletting spot. Why is
Right.
that, and how did you discover that?
So I discovered it. Well, initially, I mean, it is known in Chinese medicine to be a top bloodletting spot, and then for any problems of the head, the mouth, um, anything from really, let's say, the sternum, let's say the diaphragm up, um, and particularly things having to do with nerve pain. So if somebody comes in and says, "Oh, I have shooting pain from my shoulder down to my fingers," that's something where I would poke the top of the ear and try to get some blood out, and very likely it would help. And it's difficult. I mean, if you ask me, um, to explain in Western medical terms why that works, I would have trouble doing that. I can tell you that I do have a patient who is a professor of anatomy at a medical school here, and I do bloodletting on him. He became very interested in it, and so because I was working on him, and so he came up with a theory, and he explained to me that the superficial veins are connected to the deeper veins through, what did he call them? Um, anyway, there are veins that connect them, and so by communicating veins, and so by taking some blood out of, and if there's some congestion, venous congestion in the deeper veins, then by taking some blood out of the superficial veins, it can relieve venous congestion in the deeper veins through the communicating veins. So that's the best I can do at a Western medicine
Right.
explanation.
Right. Now, in your book, I learned that um, there was a mainstream scientific study in which people who gave blood, regular good citizen blood donors giving to their local blood bank, had something like a 90% reduced risk of heart attacks in a period of time after that. So apparently
That's
this has letting your blood flow has positive effects.
Yes, it does. And removing some blood has positive effects. And yeah, that's a Finnish study was done and just amazing results. I mean, it blows statins out of the water.
Yeah.
If there was ever a drug that had these effects, I mean, my God, everybody in the world would be on it. They'd put it in the water supply. But
So I think we've established that the best thing you can do to prevent heart attacks is the low-fat vegan diet that my podcast is dedicated to, and the occasional blood donation.
and blood donation is a really good idea. And if you look at, I mean, women prior to menopause virtually are immune from heart attacks. And, you know,
Yeah.
is it because they quote give blood every month? Well, that's certainly one possibility. As soon as they go through menopause, they have the same risk as men.
It's fascinating. Um, so is most of your practice about relieving pain, or do people come to you for other conditions that you find that either acupuncture or bloodletting works for?
Uh, People do mostly come to me for pain, and that's what I like to treat. Sometimes people will come with things like, digestive upsets, diarrhea, constipation. But the main thing I treat is pain.
And what would you say your batting average is?
Hmm. Boy, that's so hard to answer because uh,
I guess some people you help a little and other people you help a lot, right? So,
yeah, some people I help quickly, some people not so quickly. Um, but with musculoskeletal, it's I don't know, 70, 80% off the top of my head.
uh-huh.
I mean, definitely I'm able to help. If if I do everything I can, maybe even better than that, because if I do everything that I know how to do, and they still say, there's no change, that's surprising to me. It doesn't happen that often. It does happen, of course,
And
but
how much did your effectiveness improve about halfway into your career when you added bloodletting to your practice?
oh, tremendously. I wouldn't even know how to put a number on it. Not only in the percentage of people who respond, but in the quickness that they respond. Uh, because there are things that are impossible, like things that there is no practitioner of any, chiropractic surgeon, physical therapist, I mean, massage therapist, nobody can help. And
What
yet,
kinds of things?
okay, I'll tell you in a second. With just a very small amount of bloodletting, you can relieve it. And I was thinking about this one, and the analogy I came up with is it's like you're faced with a bank vault. And I mean, it's just impossible to get in there. But if you know the trick, you can open it with a hairpin.
Mhm.
And that's sort of the way I see bloodletting. So, for example, I mean, just a few days ago, I had a guy come in and he had testicular pain, his left testicle. And he had been to a doctor, and the doctor examined him and said, "There's nothing." And he talked to a surgeon, and the surgeon didn't think he could help him. I mean, this is the kind of thing that there's, I mean, probably nobody would be able to help him, including
I think
acupuncturists
you
who
bled the
didn't do.
left ear. Am I right?
No, I bled his left leg. I'll
Oh,
show
okay.
you later that clip I have of bleeding spider veins in the leg, and this isn't that patient, but But what I did is very similar. And I talked to him. I said, give me a call in a week. I didn't even schedule a follow-up because I thought either this is going to work, which I thought it would, and he won't need to see me for another 6 months or a year or longer, or it's not going to work. There's one other thing I could try, one other type of bleeding. Um, but he called me a week later and he said he has had zero pain since the bleeding,
Wow.
so it's 100% success. So
Do you know how long he had suffered in pain before he went to see you?
like 3 weeks, I think he said.
Okay. So, and when you bled him, how long did that take?
Oh, I mean, from the time he got on the table to the time he left, maybe 30 minutes, 35 minutes.
And how
The
much of that
actual,
time was he bleeding?
oh, 15 minutes.
Okay. So
So it's
15 minutes of blood just trickling out, right?
yeah, you'll see in the clip that I'll show you a little later, what it looks like to do the bloodletting. The clip is about 6 minutes.
Okay. And we'll see that in a moment. And so sometimes, though, I read in your book that sometimes the blood spurts out and you have to be prepared for that. So, how do you prepare for that?
That's very rare, very, very, very rare. But I do mention it. It happened to me maybe 3 times, twice with the same person,
Hmm.
and then with one other person. Um, Very, very rare. But I always have a paper cup at the ready. And if somebody starts bleeding, you know, you don't want to stop the bleeding artificially because it's liable to start again later when they're at home, and that's going to scare the hell out of them. So you want it to just, bleed out until the pressure is gone. Um, but if you, as a as an acupuncturist, if you watch this blood spurting out, it's scary because you know you don't want them to lose too much blood.
Right. And
Um,
are you wearing goggles?
no, I don't wear goggles. I wear
Okay.
gloves, of course, but I don't wear. I have glasses, so that
Okay.
I guess that would protect me somewhat. Um, but anyway, so the paper cup trick is important because it spurts, and the trick is to catch all of the blood in the cup, and then that way you can see how much blood they've lost. And the stream is actually very thin, and you find that one patient spurted for about 7 minutes. I mean, this is one patient out of thousands. It's
Right.
very, very rare. Um, but after 7 minutes, maybe she had lost 50, 60 milliliters of blood. Now, when you donate blood, it's 500 milliliters. It's a pint of blood. It's almost 500 milliliters. So this was 1/10 of that. So, being able to look in the cup and see that it wasn't really that much blood gives me the confidence to be able to just, let her bleed until it stopped on its own.
Right. All right. So, why don't we do that screen share again?
Okay.
You'll show us the video. For those who are listening to the audio podcast, if you could narrate it a little bit and tell them, of course, watching it on YouTube will be best, but go ahead and do the screen share. So, for those of you listening on the audio podcast right now, Dean Mosher, author of The Complete Guide to Chinese Medicine Bloodletting, is looking for his video.
All right. So there we go. All right. So I'm going to start this. So this is a patient named Linda. She is in her 70s. She is a substitute teacher at a school. She still works. And she has peripheral neuropathy, which is a numbness in her lower legs and her feet. And as she'll say, her numbness was so bad that she went to the emergency room once and they found glass in the bottom of her foot and she didn't even feel it. So anyway, this is typical of bleeding of the lower leg, and this is what I did on my patient with testicular pain, and also works great for hemorrhoids, um, and for also for peripheral neuropathy. So here we go. Are you having audio too? Can you?
Um, no, I don't hear any audio.
Oh,
So,
okay.
I can hear you, but nothing from the.
I see.
Okay,
Okay,
we're
so I'm
seeing
looking.
bleeding now.
Yeah. Okay. So I'll just narrate it then.
Yeah.
Um, so I'm looking for um, I'm looking for spider veins. I see some spider veins there, and so I just take a hypodermic needle, go very, very superficially, just just a millimeter or two deep, and then I keep it going by swabbing it with alcohol. I want it to keep going, and so it stops on its own. And you can see at the very beginning it was very dark. So dark blood that's the color of blood stasis. And if the blood comes out bright red, then I know this is not going to be effective because there was no blood stasis. If it's dark like this, it's already starting to lighten up a little bit. Um, it it's much more likely to be effective. So I'm going to do another one. You can see the dark spot. There you go. Okay. And all right. So I'm going to fast forward this. So you can see I'm going to do her other leg.
So for those listening on the audio podcast, Dean is using a needle to bleed the patient in a few different places on the leg, and the blood sort of oozes out. It's a dark color and it gets lighter over time.
All right. So here's her other leg, and you can
Full
see
of
some
spider veins.
spider veins, right? So those dark veins. And these are the ones that I like, or like where you just see one spot like that. And so you can see here's that one spot, one dark spot. I know there's going to be a lot of dark blood coming out of there, and look
Very
at how
dark
dark that
blood.
blood is. Very dark. So that's blood stasis. I know this is going to be effective. I know that she's going to feel better after this. So let's see.
You wipe the blood and it keeps flowing,
Yeah,
and as it keeps flowing, it gets lighter.
right. All right. So
And does
that's
this work for aesthetic purposes too, that the spider veins diminish?
they do. Yes. I mean, it's not. So there's something called sclerotherapy where they inject something into the vein that makes the vein just shrivel up and disappear. I don't recommend that because I think it just drives blood stasis deeper into the body. Whereas if you do this, you actually relieve the blood stasis. It doesn't make the spider vein disappear completely, but it fades it a lot. So I'd say that most of the women I treat um, are very happy with the cosmetic result. So that's all I have. You can stop the screen sharing if you like.
Okay. So do you get patients who come to you for cosmetic reasons with the spider veins?
I don't think so. I mean, maybe patients mention it. Um, they come for something else,
Hmm.
and maybe they mention it, but I've never had somebody I don't think come,
Yeah.
and
You could set
their
up
only
practice in
complaint is,
Beverly Hills, and that would be a lucrative practice, my friend.
I'll bet Gwyneth Paltrow would be my first client, right? She would spread it amongst all her friends, and
Does she have
maybe
spider
that's a
veins?
plan. Um, I don't know if she does or not, but
Okay.
but she's into, Chinese medicine and naturopathic approaches to cosmetic problems. So that's
Now,
what made me
now
think
that
things come
episode of
from.
St. Elsewhere that I wrote, my first meeting in Hollywood was in her late father's, Bruce Paltrow's office. And I
Oh,
actually made I guess, an enemy for life. When I wrote that episode, should I tell you the story?
yeah, that's very interesting.
All right. So I had been in Buffalo before moving to LA, and everyone in Buffalo said, "Oh, you're moving to LA? Call Tom Fontana." I didn't know who he was, but they gave me his phone number. So I called him and I hear Tom Fontana's office, St. Elsewhere. So, oh, he was a writer on St. Elsewhere. So I said, tell him Glenn called. Everyone in Buffalo said to call him. So he was the nicest guy in the world. He called me back over the weekend, talked to me for a long time, asked me to send in some writing, and he hired me to write the St. Elsewhere. So I go in to write the St. Elsewhere, my first assignment in Hollywood, and I'm figuring, hey, I'm a grown up now, I'm a professional. I had a suitcase, not a suit, I'm sorry, a briefcase, the kind of thing lawyers have. And I thought, I'm a professional, I should bring in this briefcase. I have no idea what I was thinking. What did I put in the briefcase? I don't know, a notepad and a pen? I don't know. So I go into the office at St. Elsewhere, Bruce Paltrow's office, with my briefcase. And there were three producers there, writer producers. There was a guy named John, a guy named Channing, both very nice guys. And the other guy, I won't say his real name, but let's say he was Joe Smith, right? So I say hi to John, say hi to Channing, and then I extend my hand to say hi to Joe Smith, and he doesn't shake my hand. He looks the other way, walks out of the room, slams the door. So I say to John and Channing, did I say something to offend Joe Smith? What they say, no, don't take it personally. That's just Joe. That's just he's having some problem. Don't worry. No, it's not got nothing to do with you. Don't take it personally. And then they tell me to write the episode with the leeches. So I go home for 2 weeks or so, write that episode, send it in, come back to meet with them. I see John, I see Channing, shake their hands. I see Joe Smith. I go to shake his hand. He doesn't shake my hand. Storms out of the room, slams the door. And I say, what? Again? Did I say something? No, Glenn, it has nothing to do with you. Don't take it personally. He's got some things going. No, don't forget about it. So then they give me the notes on the episode and I do a rewrite and I send it in. And that episode aired as my first television episode with the leeches. They changed everything else, but it had the leeches in it. And then about a year later, I was hired by a TV writer, a very famous TV writer named David Milch. He hired me to write an episode of a pilot he had. And he said, Glenn, before I hired you, I read your episode of St. Elsewhere. And then I checked up on you and I called John and Channing and they said very good things about you. He said, but could I ask you a question? I said, yeah. He said, what the hell did you do to Joe Smith? He hates your guts. So that was my first enemy in Hollywood. I just said
Did
hi.
you ever find out?
No, I think it was the briefcase. I think it was stupid to walk in with that briefcase. That's the only, I only said hi to the guy.
Wow,
Yeah. So
what a
there's a guy you
mystery.
might want to bleed, just a suggestion.
Well, I need to bleed the apex of his ear because that's
Yeah.
for anxiety and
Yeah.
emotional problems. Apex of the ear is the way to go.
Okay. Well, I hope to see you maybe in the spring, Dean, and maybe I'll have you bleed me.
Okay,
Uh,
I will keep some needles available.
all right. Well, we'll put a link to the book, and if you'd like to your website in the show notes. The book is called The Complete Guide to Chinese Medicine Bloodletting. And one last question. How many people are doing this in the country? Any idea?
Bloodletting?
Yeah.
I really don't know. I mean, it must be hundreds based
Yeah.
on the feedback I get. And to what extent are they doing it? The people who really do it a lot in their practice. I mean, there are the people who really do it a lot. There are the people who are sort of timid about it. So one of the questions that I get a lot is, well, how do I bring this up to patients? How like, and somehow acupuncturists have this idea that they have to um, explain to patients like what they're doing. And I had an experience very early on in bloodletting. There was a Chinese guy who came in, and he had sciatica, and I wanted to do bloodletting on him. And I start to explain to him. His English wasn't very good, and I'm explaining to him, well, you know, sometimes blah blah blah. And he's looking at me and looking at me, and then finally he says to me, "Okay, okay, okay, okay," as if to say, I'm in pain here, you idiot. Can you just bleed me and shut up? So that 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 made me realize, people are coming for me to do the best acupuncture I can do. If
Right.
that's bloodletting, so at this point, the less said, the better. I just say this is what we call blood stasis. So if I can take out a little bit of blood, that can relieve the blood stasis, and you'll probably feel better. And they say, fine.
All right. Well, it's a fascinating field, and it sounds to me like you're doing a service by guiding fellow practitioners to consider engaging in this. And
Yeah, I would say that prior, if there's anything that I've contributed, I think it's to make it easy. Um, it seems, I mean, there are Chinese practitioners who do it in a way that most American practitioners would not want to follow. I mean, they're pretty aggressive. And it turns out you don't really need to be very aggressive. You saw what I did on that one woman, and
yeah,
it's very mild, and that's all you need. And I think,
yeah,
you know, I try to show people how to do it in a way that's, easily accepted by them and easily accepted by patients. And I think that's helped it grow somewhat.
right. Well, Dean, it's great to see you again. Again, we'll put those links in the show notes and hope to see you in person before too long.
Sounds good. I'll look forward to it.